And now, it's Boomer Life. Lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
And welcome to Boomer Life on CL 650. I'm Joanne Sutton. Thanks for joining us today. On Boomer Life today, we're going to be focusing on your health. And in the studio with us from SmartShape Canada, we say welcome to Dr. Chris Coburn. So thanks for joining us.
Good morning, Joanne. Thank you very much for having me.
Excellent. So Dr. Coburn introduced laparoscopic surgery to the Mississauga area back in 1991. Since then, he's been focusing his time and practice on advanced laparoscopic surgery. So currently, he's a general surgeon at Trillium Health Centre and the medical director and surgeon at the SmartShape Weight Loss Centre, offering the most comprehensive weight loss management programs right across Canada. And basically, that's why you're here today. So Dr. Coburn, he's a leading expert in advanced laparoscopic surgery, including the lap band procedure. And we asked the question, why SmartShape? Well, SmartShape is the only clinic in Canada to offer a variety of bariatric procedures like the lap band, the gastric sleeve, and the gastric balloon programs in many locations across Canada as treatment options for obesity. It's the first time we've mentioned obesity, and that will be a major point in our conversation today. But have I summed up what you do and what SmartShape is? Maybe you could put it into your own words for us.
Sure. Well, again, thank you very much. SmartShape is a clinic that's been in existence for over 11 years now, and we've treated well in excess of 5,000 patients with a variety of options, surgical options for the most part, but effective options to achieve both sustained and significant weight loss for our patients. And we deal with the problem of obesity, which is one of the major health concerns of society across the world, but especially in North America and Canada.
So let's talk about weight loss for a little bit, and maybe the stigma that's associated with it, and how difficult it is, and the type of person that might be attracted to SmartShape.
Well, about 60% of the Canadian population now is either overweight or obese. And what that means is that this is not just the fact that people are overweight, but in fact the health issues that go along with that, be it diabetes. The link between obesity and diabetes is well known. In fact, we use the term diabesity to just relay that information. High blood pressure, high cholesterol, sleep apnea, arthritis, and a whole series of cancers that are all related to weight. And if we don't come to grips with the problem of obesity and deal with it, it's going to have, it is now and will continue to have significant implications for our health. Absolutely.
1 in 4 adult Canadians and 1 in 10 children are clinically obese, meaning 6 million Canadians.
Right. Right. And unfortunately, the solutions that are typically prescribed for obesity, being diet and exercise, for the overwhelming majority of people are not effective. The effectiveness, we know that with any of the commercially available diets, only 2% of people are able to keep off 20 pounds for 2 years. So people may be able to lose weight with various diets, but unless they keep the weight off, it's really of no value to them whatsoever.
So as a surgeon, and you specialize in different weight loss options, what other background do you have to support the fact that diets just don't work? And we've tried a million of them over the years.
Yeah, again, if people are able to lose weight with various diets, which is fine, but unless the weight is kept off. In fact, dieting has actually been shown to be very effective way to gain weight, because most people who lose weight with the diet will then subsequently gain even more weight than they did before they started the diet.
Sure. You lose 10, you gain 15, you lose 10, and then, by the time you're 50 or 60, you're up 30 pounds.
Which is unfortunate. And it's an easy thing for, your doctor to tell you to diet or exercise, thinking that might be effective, but it's not. As far as exercise, there's never been a study that showed us that exercise alone, in the absence of some sort of restricted caloric intake, leads to effective weight loss. And I don't mean to downplay the role of exercise, because
exercise... there's important.
Oh, absolutely. Yeah. Exercise is critical at improving one's cardiovascular health, reducing the risk of developing diabetes, and a whole series of other health issues. So no matter how much somebody weighs, it's important that they be active. But we shouldn't rely on exercise alone as a means of inducing significant weight loss.
Oh, certainly. And not one product or program or diet or lifestyle change is good for everybody. There's just not one single recipe.
No, there isn't. And we realize that people to lose weight need to reduce their portions. I mean, that's how people gain weight, is not by what they eat, but always how much.
I think I actually had a doctor say that to me once. He said, well, how are you? And I said, pretty good, but I keep gaining weight. And he said, don't eat so much.
Yeah, well, that's easy to say. At SmartShape, we have a number of options and programs that are all designed to do exactly the same thing. And that means to reduce the portions, allowing somebody to feel satisfied or comfortable or full, but with, let's say, a bread plate or a dessert plate of food rather than the big dinner plate.
Okay, that's a really good point. We will talk about that in more detail. So let us know right now a little bit more about SmartShape and the proven weight loss programs that you offer, and what would be some of the main reasons for some of us to consult with you at SmartShape.
So at SmartShape, we have clinics across the country. We have facilities in Vancouver, Calgary, Regina, Winnipeg, Toronto, and Mississauga, where we offer a variety of programs, basically 3 programs. The one that we do the most of is the lap band procedure. Again, I've done somewhere close to 5,000 procedures in the past 11 years. Very effective, very safe procedure. And we can go through that in a bit, exactly what that does, what the lap band does. The second procedure that we're doing more and more of now are the gastric sleeves. Gastric sleeve is an operation, again, done laparoscopically, but where a significant portion of the stomach is actually removed, leaving a long sleeve of stomach behind.
So it is an actual surgery?
Yeah, so both the lap band and the gastric sleeve are operations. They do require a general anesthetic. They're both done they're all minimally invasive procedures, so there's no big incisions. And the third procedure we do at SmartShape is called the gastric balloon procedure, which is a procedure where we basically look into the stomach and inflate a balloon and leave it in the upper part of the stomach for 6 months, and then it comes out. And the balloon is an effective procedure, but generally for people who have less weight to lose and who had trouble with their weight for a shorter period of time.
So if someone is actually interested in the lap band surgery or one of the other programs that you're offering, because you just listed off 3, what type of a referral do they need, or what type of special consult do they get? Do they start with their family doctor, or what do they do?
So a lot of patients certainly are referred to us through their family physicians, but we have a very comprehensive website at www.smartshape.ca, which explains the various procedures we have, describes the programs that go along with them, because all of these are not merely operations. These are 5-year programs offering counseling and support for any of the procedures that a patient may choose. So we certainly would encourage people to go to the website and start gathering information. We have a great team of people, program advisors, who are able to then, if you call, take the next step and give you more information. And if indeed one of these procedures is something that interests you, then you get a free consultation with one of our surgeons at one of the centers across the country.
So this would be an obvious question, but is SmartShape a safe procedure or a safe program to follow?
Yeah, I mean, all 3 procedures are safe. Again, in excess of 5,000 procedures. We've not had anybody who's had any serious complications, certainly no deaths or major infections or bleeding. And so, because you want that, you're taking, for the most part, people who may be healthy but have a weight problem. And I think if they are exposed to a procedure that has a significant risk factor, you really have to question whether that's the right thing to do. So yes, the procedures we do at SmartShape are safe.
Okay, then let's go to the next obvious question of, are they successful? How effectively are we going to lose weight if we embark on one of your programs?
Yeah. So the definition of success is very interesting when it comes to the world of weight loss. We have learned at SmartShape that success is not measured by how many pounds somebody weighs or how many pounds they lose. But in fact, it begins at the time of the consultation when we try and decide, why does somebody want to lose weight? And success can be measured by simple things like being able to shop in a normal-sized clothing store, run up a flight of stairs without being short of breath, ride a bicycle, play on the floor with your kids. There are health issues. There are diabetes and blood pressure and cholesterol and sleep apnea and all sorts of obvious health issues that would benefit from the weight loss with procedures at SmartShape. But it's not measured. Success, we find, is not strictly measured by the number of pounds.
I think that would be a great saying to sort of print on your mirror. Just one of those positive reinforcement statements. Success is not measured by pounds. So is everyone eligible for this?
Well, no. I mean, part of the discussion is figuring out what does somebody want to accomplish? Is their BMI at a level that these procedures would be considered safe and effective? Basically, we do procedures. The balloon, somebody with a BMI between 27 and 32 typically is a candidate for the balloon.
Can you just explain what the BMI is in case
sure.
A listener isn't aware of it?
Sorry about that. Body mass, BMI is body mass index.
Yes.
You can find it all through the internet if you want to figure out what your BMI is, but it's basically a function of both your height and your weight. And albeit it's not a perfect measure, certainly not a measure of the risk associated with being overweight, but it is the standard measure we use because there are associations with higher BMI being at risk for more health problems.
So we're not just talking about people that have an excess 10 pounds on their body.
No, generally not. I mean, our average patient at SmartShape, our typical patient, is a woman. 80% of our patients are women, but it would be typically a 45-year-old woman who's 5 feet 4 inches tall, 285 pounds with a BMI of 45. That would be average, but as mentioned, we do see patients and help patients with a BMI from 27 up to 60s and 70s.
So we've established that SmartShape offers safe weight loss options. It offers successful weight loss options, and you've actually brought some props in with you today, so we'll be able to give our listeners a play-by-play, and if they go to our website, they'll also be able to get a visual of what's involved with these procedures. Could you give us the top three again?
So the three procedures: the lap band procedure, or laparoscopic adjustable gastric band, the gastric sleeve, and then the gastric balloon.
Excellent.
And yes, they're effective, but we emphasize throughout the whole process of people, through the consultation and everything before that all of these are simply tools. They're tools that allow people to achieve significant and sustained weight loss, but you need to work with them. And that basically means not so much changing what you eat, but important to change how you eat. In order to make changes, in order for these procedures to work, people need to be trained and learn how to, for example, chew their food well and to eat slowly. And that sounds like maybe an easy thing to do, but it's very difficult because in today's society, we don't.
So it's not just a quick fix. No. You need participation from the patient as well.
Absolutely.
Yes.
There's certainly not a quick fix, and we do our best to make sure people don't think they're a quick fix. That's why we offer the program. That's why we offer 5 years of care, counseling, advice, work with our nurses and coaches and dietitians, 5 years of care to give people the opportunity to get the most out of these procedures they possibly can.
It sounds like you have a great team to support, a little bit of hand-holding too, right?
Yeah, no, there's a lot of that. And again, at SmartShape, that's what we pride ourselves on, this is not a short-term fix. It's not something magic, but they are safe and effective solutions for people who would be interested.
Excellent. You are listening to Boomer Life. I'm Joanne Sutton. Today we're talking about your health, and we're joined in studio by Dr. Chris Coburn from SmartShape Canada. If you want more information about our conversation today, please visit the website smartshape.ca. And there's more to learn about this variety of weight loss programs from SmartShape. We're going to be right back with the details on Boomer Life on CL 650.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CL 650.